I've noticed my hair thinning last couple of months, but there's no history of baldness in my family. I'm a bit confused and worried. It sounds like you may be dealing with non-hereditary hair loss. Unlike genetic hair loss, this type isn't passed down from parents. So what is non-hereditary hair loss exactly? Non-hereditary hair loss refers to hair loss not caused by genetics. It can happen due to external or internal factors, often reversible depending on the cause. What kinds of things that can cause it? There are several triggers. Some common causes include emotional and physical stress, poor diet or sudden weight loss, medications like chemotherapy, antidepressants or blood pressure drugs, hormonal imbalance in thyroid disorders, pregnancy, menopause, autoimmune conditions such as alopecia areata, infections like scalp ringworm, trauma to hair follicles from tight hairstyle to excessive styling. I didn't realize there were so many reasons. I also want to know more about the hair growth cycle. Hair growth follows a cycle with three main phases. Anagen phase. This is when active hair growth takes place. At any one time, most hairs are in this phase. It lasts up to 6 years or longer in scalp hair. Catagen phase. This is when hair growth stops and the hair follicle shrinks. 1 to 3% of hairs are in this phase, which lasts 2 to 3 weeks. Telogen phase. This is a resting phase lasting 1 to 4 months. At any one time, about 10% of scalp hair is in this phase. At the end of the resting phase, your hair goes through a shedding phase. This is when a hair falls out. When a hair is shed, it's replaced by a new hair from the same hair follicle. Are there different types of this hair loss? Yes, there are a few different types of abnormal hair loss, such as telogen hair loss, sudden shedding due to stress, illness, or surgery, alopecia areata, and autoimmune conditions causing patchy hair loss, traumatic hair loss from tight hairstyles, pulling on hair, anagen hair loss, typically from cancer treatments, infections, skin conditions like dandruff, psoriasis can also cause hair loss. What are the symptoms of abnormal hair loss? Hair loss could affect just your scalp, hair on another part of your body, or all of your hair on your body, with increased hair shedding that happens suddenly, patchy hair loss, or broken hair depending on the cause. Is it treatable? Most abnormal hair loss gets better when the cause gets better. Often your hair will grow back on its own without treatment. If treatment is needed, it will depend on the cause. Is there anything I could have done to prevent this? In many cases, yes. Balanced diet rich in iron, protein, and vitamins. Manage stress through mindfulness or therapy. Avoid harsh hair treatments like dyes, heat, and tight styles. Regular scalp hygiene addresses health issues like thyroid or anemia early. That was so helpful. Follow Selene the nurse to learn more about your health.